President of the National House of Chiefs, Togbe Afede, has implored the Ghana Health Service to treat cerebrospinal meningitis as a national emergency issue and is calling for mobilization of national support against the disease. Togbe Afede said there should be a concerted national action plan to support the people of the northern regions to bring the deadly disease under control. Togbe Afede made the statement in a speech read on his behalf after donating 50,000 Ghana cedis cash amount to the Upper West Regional Hospital for use, among other things, a seed fund for local research for the development of a vaccine for CSM. Joining us is Upper West Regional correspondent Rafiq Salam has more.
Cerebrospinal meningitis (CSM), the past 3 months has wreaked havoc in 5 regions in the northern belt of the country. 409 persons have been confirmed to have the disease. The disease has also claimed the lives of several dozens of people, the highest in the Upper West region. 40 people lost their lives, more than half of the deaths coming from the Juba municipality and Nandam district. Health authorities in the Upper West region blame most of the deaths on a new strain called serotype X, which they claim they have no vaccine for.
Worldwide, we don't have a vaccine for serotype X. Even if we have, you find it in 1 or 2 countries. And in our country, we don't even have, WHO hasn't licensed, I don't think WHO has licensed any vaccine for serotype X.
However, President of the Upper West Regional House of Chiefs, Cerebrospinal, reading a speech on behalf of the President of the National House of Chiefs, Togbe Afede, was not happy with the amount of attention given to a disease that has so far claimed 40 lives.
While we as a nation are busily battling COVID-19 pandemic, which has taken our lives so far, with all the energy and resources we can master the CSM epidemic, should also be given the needed urgent attention and treated with all the seriousness it deserves.
He has therefore implored the Ghana Health Service to declare the outbreak of CSM in the northern Gulf of the country as a national health emergency.
There should be a concerted national action plan to support the people of the northern regions to bring this deadly disease under control. We must mobilize national support against CSM now. The government and our development partners, as well as the corporate community, should support research towards the development of a vaccine for the treatment of. I would also like to urge victims and people suspected CSM to report early to hospital for timely treatment.
Kworo Richard Babini Kantong, also on behalf of the President of the National House of Chiefs, donated a cash amount of 50,000 Ghana cedis to the Upper West Regional Hospital.
30,000 should serve as seed money for the establishment of a fund to support local research towards the development of a vaccine for the treatment of CSM. 20,000 cedis cash should go into the procurement of emergency medical supplies to support the delivery of quality and timely services to patients receiving treatment for suspected CSM-related cases.
Acting Medical Superintendent of the Upper West Regional Hospital, Dr. Robert Amesiye, was grateful to the President of the National House of Chiefs, Togbe Afede, for his kind gesture, urging others to emulate his example.
We are happy for this donation, even though the first donation is coming from somebody that is not a son of the region, but I think this is just the beginning. I'm sure when sons of Upper West region hear that a chief, in the Volta region has seen that there's a hospital that began operations in Upper West region that is doing a worthy cause, I'm sure many sons and daughters of the region will also follow suit to do what is expected of them.